It's all about splinting, and splinting is a technique used to help reduce pain and discomfort and support the chest or abdominal area during coughing. Splinting is especially beneficial for patients recovering from either abdominal or thoracic surgery, rib fractures, or even severe respiratory conditions. By reducing pain and providing support, it really helps patients perform necessary coughing with less pain and encourages patients to cough effectively to clear their mucus, and that's so important. So why splinting techniques are used is because it provides a protective support to prevent excess movement, and also we don't want to strain or injure the sensitive areas that are already affected.